Laura Kyrke-Smith.
Thank you, Mr. Speaker. I beg to move that leave be given to bring in a bill to require the provision of mental health assessments in NHS antenatal care for the purpose of identifying those at risk of perinatal mental health problems and making referrals to appropriate support, and for connected purposes. Madam Deputy Speaker, we often assume that pregnancy, birth and the year after birth are a time of life to be happy, celebrating the arrival of a new baby, embarking on a new chapter in family life. And for some people, this is how it pans out. But for many, the reality is much tougher. I've spoken previously in this House about my brilliant friend Sophie, who took her own life after the birth of her third child, who was just 10 weeks old at the time. That was 4 years ago, and her death remains a huge sadness in my life and for her family, some of whom are in the gallery today. But the shock of it still sits with me too. I didn't know, and many of us don't, that suicide is the leading cause of death for a woman in that period from 6 weeks to a year after giving birth, a statistic recently reconfirmed by the latest Embrace UK report. And while Sophie's death is a particularly serious example, I also didn't know the scale and normality of mental illness at that time in a woman's life. 1 in 4 women experience some sort of mental health difficulties during pregnancy or after giving birth. It can be anything from depression to anxiety to obsessive-compulsive disorder or post-traumatic stress disorder, and it can be completely debilitating for mums and their families. And the consequences ripple out more widely too. The London School of Economics and the Centre for Mental Health estimate that untreated perinatal mental illness costs this country over £8 billion a year, largely through the long-term impact on the child's health, education and future productivity. Madam Deputy Speaker, in theory, women are asked about their mental health early in pregnancy. The guidance from NICE, the National Institute for Health and Care Excellence, specifies that questions about depression and anxiety should form part of a woman's first contact with health professionals during pregnancy, including the booking appointment. But in practice, women's experiences vary enormously. Some women are asked a few hurried questions between blood pressure checks. Others are not asked at all. Women with a previous history of mental illness may be given more attention, but we know that pregnancy and early motherhood can often be the first time that women experience mental illness, so that's not enough. Some GPs and midwives have the training and time to offer support. Others are stretched far beyond capacity. Some have established mental health services to refer women onto. Some are almost afraid to ask the right questions because they don't trust that a referral will kick in. So the result is a postcode lottery where a pregnant woman's access to mental health support can depend on the NHS trust they happen to fall under. But it's also a lottery that a woman is more likely to lose if they are black, Asian, young, experiencing domestic violence, experiencing poverty or other forms of deprivation. Because as in so many other areas of healthcare, the pre-existing inequalities correlate with poorer outcomes. And that's why this bill matters, because every woman, regardless of age, ethnicity, background or postcode, deserves the same standard of care and the same chance to be mentally well at this time in their life. Madam Deputy Speaker, we're not starting from scratch. In the 10-year health plan, the government has set out its determination and its plan to reorient our health system away from treatment towards prevention, away from hospitals towards the community. Ensuring that pregnant and new mums are mentally well is one of the ultimate acts of prevention, setting them and their children up for a healthy, productive future. On mental health specifically, including on better support for suicidal people, the government has also made its commitment very clear and matched it with action. In the last year, an additional 6,700 mental health professionals have been recruited. £120 million is being invested in dedicated mental health emergency departments, ensuring that those in crisis can get help quickly. And we're rolling out the Best Start Family Hubs, which are a transformative initiative that will provide families with a single route into support services, including mental health. So my bill builds on these commitments, but it focuses the mental health support at the very start of motherhood when women need it most. We're not starting from scratch in our understanding of good practice either. At a roundtable I convened here in Parliament in September, bringing together NHS England, the Maternal Mental Health Alliance, the Royal Colleges, parents with lived experience, other experts, the message was united and clear. Professionals want to help, but they need structure and time and training to do it properly. The Royal College of Midwives has just published a roadmap for perinatal mental health care, which sets out what this could look like, and it's well worth a read. But I'll turn to the detailed proposals in the bill. It sets out a clear, practical framework for mental health assessments, and it has 4 core pillars. The first is to ensure that every pregnant woman has a structured, evidence-based and compassionate mental health assessment. While mental health check-ins must continue after the birth of a baby too, the evidence shows that outcomes are better when interventions happen sooner. So that's why I focus my bill on improving support in the antenatal period first. This assessment would form part of the routine antenatal care. It's not an extra. It would use validated tools such as the Hooley questions or the Edinburgh postnatal depression scale adapted for pregnancy, and it would be rooted in NICE guidance, though this may need updating to ensure that better practice is embedded. Crucially, it would be delivered through trauma-informed conversations, not tick-box exercises, where staff would be trained to create a safe space for disclosure, recognising that women may have histories of trauma that affect their mental health during pregnancy, or may have no history of trauma or mental illness at all. The second pillar of the bill is to improve training and supervision for all professionals involved in maternity care. GPs, midwives, obstetricians, health visitors and community mental health practitioners all need the knowledge and confidence to ask the right questions, to do so compassionately and to recognise when something isn't right. This bill calls for a national training standard endorsed by NICE and the Royal Colleges and delivered across NHS trusts and integrated care boards. It should include regular clinical supervision so staff are supported to ask questions and make decisions safely. And importantly, this training must equip professionals to recognise and respond to the specific needs of women from diverse backgrounds, understanding cultural differences in how mental health is expressed and experienced, and addressing the stigma and the barriers that prevent some women from seeking help. Third, this bill sets out the need for clear referral pathways, because while midwives, GPs and others involved in routine maternity care should be equipped and able to identify mental health risks, they shouldn't also be delivering the specialist care when it's needed. So the clear referral pathways into mental health services, the specialist services, are vital. The Maternal Mental Health Alliance recommends that a specialist perinatal mental health midwife is embedded in every maternity service to ensure that those risks are identified and the referrals made effectively. And that appropriate support will then be different for every woman. But one important option is the NHS Talking Therapies programme, which I know the government is committed to. And I've seen in my own constituency of Aylesbury how helpful this can be for women. And I would urge the NHS Talking Therapies services to consider women in the perinatal period as a priority group for support. There are also fantastic voluntary services out there in communities across the country, such as Pandas and many of those under the umbrella of the Hearts and Minds Partnership. And yet many women are not made aware of them through their routine antenatal care, and they should be. Fourth, and finally, this bill calls for clear accountability to ensure effective delivery of perinatal mental health assessments. NHS England and integrated care boards would be responsible for ensuring that local maternity systems introduce the single standardised assessment process, but then also crucially capture the data through the maternity services data set, allowing the outcomes to be tracked. And there must also be improved oversight of these services from the Care Quality Commission as part of its maternity inspections. Madam Deputy Speaker, I hope the aims of my bill are clear, and I hope that the government and colleagues in this House will look upon them favourably. I know resources are tight across the NHS, and I know there are particularly acute challenges in many of our mental health and maternity services, including the national shortage of midwives currently. But I also know how transformative the relatively modest measures in this bill could be for the women at the heart of the bill and for our society. It could have made a difference for Sophie, I believe, and it still could make a difference for the many women who are struggling with their mental health now or will do in future. Because ultimately this bill is about even more than mental health care for women. It's about the kind of country that we want to be. Because when parents are mentally well, they thrive, their children thrive, and our communities become places not of fear and insecurity, but of hope and opportunity. That's the kind of country that we want to be, and improved perinatal mental health care is such an important part of it. Madam Deputy Speaker, I commend this bill to the House.
Yeah. The question is that the Honourable Member have leave to bring in the bill. As many of their opinions say aye. Aye. The contrary no. The ayes have it, the ayes have it. Who will prepare and bring in the bill?
Paulette Hamilton, Sojourn Joseph, Dr Danny Chambers, Liz Twist, Sarah Hall, Maya Ellis, Jen Craft, Michelle Welsh, Anna Sabine, Lee Pitcher, Dr Simon Ofer and myself, Madam Deputy Speaker.
Laura Kyrke-Smith. Well done.
Perinatal Mental Health Assessments Bill.
Second reading what day?
Friday the 31st of October.
Friday the 31st of October.